Thank you, Senator Weinberg. Members of the committee. My name is Goldstein. I'm on the board of directors of the Coalition for Medical Marijuana of New Jersey. I serve as a media coordinator and a sort of legislative liaison for this issue.
Mr. Goldstein, would you tell us who the coalition is made up of?
The Coalition for Medical Marijuana New Jersey is a singular 501c3 nonprofit entity. It is made up of physicians, doctors, patients, and like-minded individuals who supported the Compassionate Use Medical Marijuana Act of New Jersey. It was formed in 2003 and remains the only 501c3 nonprofit in the state dedicated to this issue. I'm here to talk a bit about the process because I was invited into a series of meetings with the Department of Health and Senior Services to discuss these regulations. I want to talk about how patients, in our perspective, was completely ignored in this. Right now, today, patients have only two access points for marijuana. They can move to a state that has better regulations and has a working program, of which there are 13, or they can go out into the street and break the law. The entire point of the exercise of passing this law was to alleviate those problems. As Senator Whalen and some of the other members of this committee have pointed out, the regulations so far show a complete disregard for medicine and science and basically are a political bias towards medical marijuana. Local knowledge and input of which is available here in this room. You've heard here before this committee for many years. Everyone here today, the patients, the advocates, we've all been ignored by DHSS and Governor Christie in the process of creating these rules, which may be why they're so bad today. There should not be any cap on cannabinoid content. One of the changes in the new regulations is that it doesn't just cap THC. The line in the regulations, if you read it, says all cannabinoids, including THC. Now, if you look at that, I've spoken with cultivation experts. I don't think that it's even possible within the realm of science to grow marijuana that is less than 10% in all cannabinoid content, including THC. We need to allow provisions in New Jersey for the delivery of edibles at these alternative treatment centers. The regulations severely limit the intent of the law and the idea of the actual medical marijuana supplied to patients. Medical marijuana under the law says any mixture or preparation thereof. The regulations say only raw plant material, topical cream, and lozenges, something that is a brand new technology that is unproven. Again, I was invited to two meetings at the Department of Health and Senior Services to discuss these regulations. We were asked about the intent of the law. We were asked our opinion. All of our opinion was ignored. When the original draft of the regulations was released, we were invited into a meeting. We were handed a page, I think it was like 93 pages slapped down. We were told to read it in 30 minutes. We couldn't take copies with us and not to talk about it once we left the room. You know, this is the non-transparent air around these regulations right now, and that's really what has to change. That's why we're here today engaged in this process. The patients and advocates in this room spent 5 years working with you to pass a bill. Now we're a year later, and we should have had a program by now, but no marijuana is available yet. That's why we're here today. We beg of you to work transparently to create working regulations. Otherwise, patients will go to the underground market as they do today, or they will continue to move out of state. Thank you very much.
Thank you. Any questions?
Any questions, Chair?
Senator Keene.
Thank you. Thank you for your testimony. You've been working on this issue for about 5 years?
I've personally been working here in New Jersey for about 2 years.
Would it be better for New Jersey to implement this legislation and delay the ultimate legalization, or would you think it would be better to get it up and running, and then we could look at the process as it moves forward?
Senator Keene, as Senator Whalen pointed out, there were many restrictions added to the law before it was passed last year. That was on the basis of, let's get the program running. Something is better than nothing. That's how we got home cultivation cut out of the bill. That's how we came down to 2 ounces of plant material per month. That's how we came up with the most restrictive law in the country. So at this point, when we talk about delays, and I'm glad that you brought that up because unfortunately the implementation process has been delayed several times by DHSS and Governor Christie himself. The law was originally supposed to be running by the fall of last year. Now over the summer, if you recall, an idea was floated that Rutgers University be given a monopoly on all cultivation.
Is that a yes or no?
The law has already been delayed. The regulations that, yes, the regulations that were re-released, actually, and I do want to make this point. Regulations were re-released on the 14th last week. They actually delay the implementation into April once again. So regardless of the exercise of this committee, DHSS and Governor Christie have already delayed the law once again. So we couldn't delay it any further than it's already being delayed, I guess is the question.
But through the chair, you heard testimony saying that if we pass this legislation, the sponsor even said it would possibly delay this for another month.
Again, that might have been based on not seeing the regulations that were issued last week on the 14th. You'll note right at the top of those new regulations that the filing date is tomorrow and that the public comment period extends into April. So again, it's already been delayed. This committee would delay it no more than it's already been.
Any other questions? Thank you very much.
Thank you.
If any of you are here